Welcome to AJTV, home of plastic surgery. Today I'm going to discuss about what do you expect after liposuction, either with transfer or not. So the first thing that you do that morning for procedure is you'll have to do markings. Then after we've done the markings, we've set out the goals for your procedure. We'll proceed and do skin preparation for you. That means we are going to disinfect the skin. And then after that, we'll now take you through the anesthesia, whether you are going to do awake or under general anesthesia. Once you've administered the anesthesia, whichever form, and then we're going now to introduce what we call tumescent fluid. And the importance of that fluid is that it's going to, number one, has local anesthesia, so reduce pain during the procedure and immediately after the procedure. That's why most patients will tell you that the first up to 18 hours to 24 hours after lipo, they have a bit of numbness that goes away with time. It's because of that local anesthesia within the tumescent fluid. Number two, we have what we call adrenaline, and that is to constrict or to close off the blood vessels. The advantage of that is that when you're doing fat harvesting, the liposuction, then you're not at risk of bleeding or losing blood. The other component is anti-inflammatory that we do put in, and if it's awake, we introduce bicarbonate, which is a base. If you remember your chemistry, acid and base. So when we make the pH of the entire fluid high, it means it's more friendly to your body, as opposed to when your pH is low, then it means it's an acidic environment, and acidic environment burns. So if you want to avoid that, we usually introduce a fluid, a basic fluid, in this case sodium bicarbonate. Then once we've introduced the tumescent fluid, we usually wait between 15 to 20 minutes for the drugs to take action. Once they've taken action, then we start our liposuction. What we use here at AJ Plastic Surgery Center is power assisted, which is semi-automated. The advantage of that, it means one, you cut down on operating time because the machine rotates. So as you move in your cannula, it means you're using less energy, and the machine is doing more for you than when you're doing just manual liposuction. Once we do your lipo, we harvest your fat. Depending on the procedure for that day, either we put on a container and throw that away, or harvest in a sterile container for processing. Typically, liposuction takes something with between an hour to 3 hours, depending on the volume. That means the BMI, the targeted areas, is it one front lipo, side 360, there are arms involved. Are you going to do lipo for inner thighs? Then once you've done your lipo, we've done your harvested, we usually try to remove the fluid, the tumescent fluid, by gently massaging it out, and then close the pots and apply dressings. If there's a fat transfer involved, then the fat that has been put in a sterile container, we process that fat, we clean, and then introduce antibiotics just to make sure it's safe. And then we transfer that fat. And this is very, very important. When you're doing fat transfer, you have to do it in very small aliquots because it's a graft. And the example I like to give is when you're planting your seedlings, you want to avoid your seeds or your seedlings being very close together because they're going to compete for nutrition. Same thing with fat grafting. When you're doing your fat grafting, you're supposed to do small aliquots so that the new fat cells are able to develop new blood vessels and with time able to be independent. Because the first few days of your fat, the graft depends on osmosis. So if you pack very huge fat aliquots, it means the fat at the center is not going to get enough nutrition. It's going to die. The consequence of that is that you're going to form what we call cyst. And I'm sure that's why you find if fat transfer or fat grafting is not done the right way, you'll find you develop cyst. This is mainly I see it mainly in breast. So you find after fat transfer, you have breast lumpy masses on the breast, and when you do an ultrasound, they'll tell you it has a fluid. Those are what we call cystic masses. So that process of fat transfer, it has to be done by a trained plastic surgeon. You have to be meticulous. You have to know the plane that you are doing it. And there's a common question of fat embolism, and especially when you're doing fat transfer to the butt, because there's initially when fat transfer was being introduced, because of what I've told you about survival, the initial surgeon used to put it below the muscle, which the fat would survive but comes with the risk. The risk is that below the muscle you have channels, what we call the venous channels, or a type of blood vessels, the veins. And because they're in a low pressure area, when you put fat around it, the fat is sucked into circulation, and then that fat can travel all the way to the heart. So currently what we do for safe BBL or safe fat transfer, we usually put that fat just below the skin, or what we call subcutaneous area. In that position, one, you have your muscle and your fascia, that is a covering over the muscle. It's able to protect and hold that fat, and that fat is not able to travel into the what we call blood circulation system and then into your heart. Okay, so mostly when you go for BBL fat transfer, these are the things that you have to discuss with your surgeon, understand whether they know the plane, what we call the plane of fat grafting, and why they're using that plane. And the aliquots, it must be small aliquots. You better even stage. You get better outcome sometimes when you stage, as opposed to packing huge aliquots of fat because you want to achieve bigger results quickly. That comes with huge fat loss, or what we call low fat graft take, something to about 30%. Then everything that you've done, you lose it down the line, maybe a month or to 2 or 3 or 4 months. As you can see, our patient today is 4 months down the line. She has maintained her butt and hip size. That tells you the transfer was done with the right aliquots in the right plane. And once the fat graft has taken, it's like a tree which has grown. So it being a cell, and a living cell is able to grow. So when you gain weight, they store fat and they become bigger. And when you lose your weight, you maintain your shape, because the loss of fat is now proportional to the new body that you've given you. Next time I'll delve into the technique of fat grafting, what equipment we use and why we do what we do in terms of fat grafting. But for today, I hope I've been able to enlighten viewers about Lipo and BBL or fat grafting. Thank you.